This is Dr. Gary from First Link MRI, and this is a 23-year-old male, and the clinical history provided is shoulder pain. So they don't say if there's any trauma or anything else, but we're going to look at this. This is a shoulder, and we have three planes. This is called the axial plane, this is called the coronal plane, and this is called the sagittal plane. So all three orthogonal planes. And on this view, we see a round ball. This is the humeral head. It rotates in this cup here. It looks like a golf ball within a golf tee here. This is called the scapula, this long bone. And all this is muscle in front, muscle in back. This is the big deltoid muscle. Wraps around the front, side, and back. And also we see a little structure right here, a little triangular structure. This is called the labrum. It's kind of like the meniscus of the knee. And this labrum is attached to the periosteum of this bone here. This is the glenoid part of the scapula. So we see on this view the humeral head looks nice and round and looks good, and the glenoid looks pretty good, but there's a white line between the posterior labrum, that little black triangle, and the bone. We shouldn't see that bright line. On occasion you can see a little signal there, but this one is just too much. It goes all the way down to the very bottom. We see that bright line. So this is a tear of the posterior labrum. The anterior labrum is this little glob right here. It's harder to see. Sometimes you can see a normal signal underneath it up top. In the middle it looks decent, but as we get down lower, 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 now we're going along the anterior inferior margin. This dark line is the cortical bone, and we see a problem. This is that labrum and joint capsule together, this glob, and there's a white band of signals. This labrum is torn, pulled off, and there's a little gap of fluid or scarring or inflammation here underneath it. So this is a torn piece of labral tissues, and also part of the joint capsule are torn and stripped right off and elevated. So this is a tear. Now when we see a tear in this region, this is usually related to, or almost always related to, a dislocation. The humeral head dislocates anteriorly and inferiorly. When it does, it often tears off this labrum, the anterior and inferior labrum, like this. Often the anterior joint capsule that it comes over here and attaches, it will strip that off and uplift that from the scapula here, but that looks pretty good. So it's just this labrum and that's uplifted, and it goes right under here. Now there's one other thing we're going to look for. When this dislocates, the humeral head will knock into the bone down here, and it usually will hit in the upper outer margin. And as we window these properly, I put a line here. We see an area of abnormal signal, the bright area here. This looks like a bone bruise or impaction injury. This is what we call a Hill-Sachs impaction injury of the humerus. And this piece of bone way up high here, way over here, it hits way down here with the dislocation. So the superior lateral humeral head impacts with the anterior inferior glenoid. So the shoulder comes a long distance and forwards and down and impacts here. So here is the tear. We see a bright band. This glob is labrum and joint capsule together, and again it's just torn right off of this glenoid, and we have the associated bone injury up here. Now in this view we see the bone injury of the humeral head. Here's the top, front, and this is towards the back. So this is the posterior lateral humeral head, and this subtle band of brightness is that impaction injury. So we'll say there's a broad Hill-Sachs impaction injury of the humeral head and an associated Bankart lesion of the anterior inferior glenoid in this patient. So we know they had a shoulder dislocation. And that's it. Thank you so much.